I'm going to go ahead and verify the orders from the doctor, whoever. I'm then going to gather all my supplies for what I'm going to need. After I do that, I'm going to go ahead and knock on the door. Hi, I'm Chelsea. I'm your nurse today. Can you tell me your name and date of birth? They tell me that. I'm going to check on the armband so it matches. I'm then going to ask if they have ever been cath before. They have. I'm still going to explain the procedure. I'm also going to ask if they have any allergies to latex, shellfish, betadine, chloroquine, anything like that. They do not. So I'm going to go ahead and raise the bed. Alright, I'm going to go ahead and provide for privacy. Alright, so now I'm going to uncover the patient. I am going to tuck the gown. I'm also going to ask them to avoid this area as it will be sterile. Okay, so I'm going to go ahead and wash my hands, do hand hygiene. I'm going to get some clean gloves. I'm now going to perform pericare. I have all my supplies needed. This has soapy water in it. I'm going to place this towel down. Also, if he still has foreskin, I would retract the foreskin back. I'm going to take my first rag, dip it in the soapy water. I'm going to clean the meatus in a circular motion. Clean part of the rag each time I clean. Then I'm going to grab this and I'm going to rinse it in a circular motion. Different part of the rag as well. Then I'm going to discard this and make sure I pat dry. Alright, so I'm going to move this out of the way. I am now done with pericare, so I'm going to discard these gloves. And I'm going to do some hand hygiene. Alright, so I'm going to go ahead and sit this down here. Before I do anything, I'm going to inspect the kit, check the expiration date, the French size, and how much fluid is going to go into the balloon, which is 5 cc's. I'm also going to make sure that I have everything. It's dry, it's not wet. Okay, so I'm going to move this over here. Alright, I'm going to carefully open, always open away from you. I am then going to go ahead and put on my sterile gloves. Alright, I'm going to grab the outside of the cuff, stick my hand in, not touching the other part of the glove. I'll fix that in just a second. Then going to slide under here.
It went a lot smoother. You were kind of, you wanted to open that stuff.
Pull, let go. And now I can situate this glove.
Yeah, right. What you needed to do because you were trying to jump ahead. I was trying not to.
I am now sterile. Alright, so I'm going to take this drape, going to drape shiny side down.
This is just the sterility part. All that important part is the beginning. It's the gathering. Yeah, wasn't that bad?
I'm going to take this straight. I'm going to place this over the penis.
Yeah.
I'm not going to use this strip, so I'm going to dispose. Alright. I'm then going to open this, put it on my cotton balls, dispose. I will then open the loop, dispose. Alright, that's all ready, so I'm going to move this closer. Okay, so I'm now going to get the catheter.
I put all of it in one of my hands, and then I take one and I clean, trash it. Take the next one, clean.
Dispose. Going to put this in the loop. take my syringe and attach it. Alright. So now I'm going to take my cotton balls, clean and circle motion, dispose, clean and circle motion, dispose, clean and circle motion, dispose, clean and circle motion, dispose again. Alright, I'm now ready to insert the catheter. Alright, I'm going to tell the patient about to insert and to take a deep breath. I'm going to insert the catheter now. For a male, you're going to watch, you're always going to watch for urine. Sorry, my syringe is. Always want to watch for urine, but we're going to go all the way in with the catheter. Alright, once we get to that little hub there, I'm going to go ahead and put 5 cc's. Alright. So I'm then going to detach that and dispose. Now you're going to pull back for resistance. Alright. So I'm done, the catheter is in. I'm going to go ahead and take my supplies, dispose. I'm done with the sterile port, so I'm gonna go ahead and take these sterile gloves off. Dispose of those. All right, I'm gonna wash my hands, ask the patient if they're okay. I'm then gonna go ahead and get some tape ready. That didn't work. Also, I'm gonna date, initial, and time one of the tapes. I'm gonna put some clean gloves on. All right, I'm gonna go ahead and take the drapes off. Make sure they're not in any pain. Dispose all of this. Now I'm going to take the catheter. And then my date, initial, and time. All right. Gonna also take this, no any urine in the bag, the color, any odor, anything like that. I'm going to hook it on the bed frame. I'm gonna go ahead and finish cleaning up. Dispose of all my equipment. My biohazard bag. Okay, I'm gonna dispose this. I'm going to take my gloves off, do hand hygiene, cover the patient back up, ask if they are in any pain, make sure they are comfortable. All right, so I'm gonna lower the bed. I will tell the patient I'll be back to check on them. I'm now gonna go document. I'm gonna document how they tolerated it, how the procedure went, how much urine was in the bag, and any odor, anything like that. I'm gonna document how much fluid I put in the balloon, the cast size, everything like that for the next nurse. Okay, so now I'm going to uncath. So the first thing I'm gonna do is verify the orders, make sure that the patient's getting uncathed today. I'm then gonna gather all my supplies. So let me do that. going to walk in, knock on the door. Hi, I'm Chelsea. I'm going to be your nurse today. We're going to go ahead and get you uncapped. Can you tell me your name and date of birth? I'm going to check. Okay, they match. So I'm going to provide for privacy. I'm going to then raise the bed. Make sure they still don't have any allergies to latex or anything like that. They do not. All right. I'm going to then uncover the patient. I'm going to do some hand hygiene, put some clean gloves on. All right. Okay. So, I'm gonna make sure, tell them to breathe. I'm gonna tell them I'm gonna go ahead and deflate the balloon. So I'm gonna get my syringe. I'm gonna get all the fluid out. Make sure all the fluid's out. And I'm gonna dispose of that in my red bag. I'm then gonna tell them to take a deep breath. And I'm just gonna pull straight out like that. I'm gonna easily take the tape off. And I'm going to document how much urine was in the bag. And then I'm gonna dispose of this in my red bag as well. However, your hospital policies are. And so I'm done with that. I'm gonna go ahead and take my gloves off. I'm going to do some hand hygiene, make sure they are comfortable. I'm going to cover them back up. And I'm going to lower the bed. Make sure they have their call light in reach. I will tell them I'll be back to check on them. And make sure they're okay. Then I'm gonna go document. I'm gonna chart how much urine is in the bag and how much solution I took out of the balloon and how they tolerated it.